I had this patient come in the other day to see me. The patient had been struggling with heel pain for multiple years. The patient talked about all the classic symptoms associated with heel pain. Pain getting up from rest, pain first thing in the morning, trouble going barefoot or on hard surfaces. And the patient was frustrated, and rightfully so. They had tried to self-treat at home with all the information that you can find on Google. Stretching, morning and night. Ice, utilizing the frozen water bottle trick. Inserts in her shoes, different types of shoes. Additionally, the patient had seen multiple other doctors and received injections and had had surgery on both feet and was still having pain. Hi, I'm Dr. David Waters from Platte River Foot and Ankle Surgeons. And the reality is that this is not that uncommon. In my many years of practice, I have treated hundreds, if not thousands of patients with heel pain. So let's take a closer look at plantar fasciitis, or heel pain as it's more commonly known. Plantar fasciitis is associated with overuse of the plantar fascia, which is a long, strong ligament on the bottom of the foot, and it goes from your heel bone all the way out to your toes. The thing is, this pain is not usually associated with an injury, but it is usually due to repetitive stress over time. It's very common. 1 in 10 people will experience plantar fasciitis or heel pain in their lifetime, and multiple professional athletes have been sidelined with this condition. Athletes like Peyton Manning, Jason Kidd, Albert Pujols, Antonio Gates, and many more. The question is, what causes this overuse injury? It's all about mechanics. Although there are some other theories we'll discuss. When we walk, you exert 2.5 times your body weight in force across the foot when just one foot is working. On the bottom of the foot, there's a thick, strong ligament structure that is called the plantar fascia. This runs, like we said, from your heel all the way to your toes. And when your mechanics are off, or you're that weekend warrior who wants to go out and go really hard on the weekends, you overdo it and end up with overuse or damage to the plantar fascia. This typically occurs back on the bottom of the heel. Some risk factors that you might have include a tight calf muscle. In fact, studies have shown that up to 80% of cases are associated with tight calf muscles. This decreases the range of motion that you have at your ankle joint and puts more strain along the plantar fascia. Prolonged standing is another risk factor. And it's not just walking we're talking about, but prolonged standing without proper support increases the amount of pronation and puts strain on the plantar fascia. Excess pronation. This is a fancy word for flattening of the arch. And it's normal motion that's part of walking. It involves the foot joints moving in multiple directions at the same time. It's what allows our feet to absorb those tremendous forces that we place across them when we walk. The problem is when we have too much pronation from having a tight calf muscle or unsupported pronation with prolonged standing without proper support of the foot, or overuse like we see with weekend warriors, those end up resulting in plantar fasciitis. Obesity is an increased risk factor due to the amount of force. And of course, improper support and improper shoe gear is also a risk factor. So let me give you an example of 2 different types of patients that I see. One is a patient who comes in and has heel pain that has been there for a couple of weeks or even a month. There's some swelling there and has pain after rest and is isolated to the heel. The other patient is the one we discussed at the top. They've been having heel pain for months or years. It comes and goes, but it's mostly there all the time. They have tried multiple treatment options. They have seen other doctors. These 2 scenarios are different. Although, as we discussed, the underlying factors are the same, how we have to address them is different. The other thing we have to consider in this scenario is that when we have prolonged heel pain, we need to consider other diagnoses that might be in play. These could be things like an entrapped nerve, a stress fracture, a condition called tarsal tunnel syndrome, which has to do with the nerves that run in that area, or other conditions that could be in play. Usually, with prolonged heel pain, some kind of additional imaging should be in play, whether that's MRI, ultrasound, maybe a nerve test, which we call an EMG, so that we can get the correct diagnosis for you. So how do we address plantar fasciitis from a treatment standpoint? As a physician, I've treated hundreds, if not thousands, of plantar fasciitis. Let me review some of the mainstays of treatment. The foundational piece in treatment in that very acute plantar fasciitis with new onset and swelling is a steroid injection. The reason we use steroids is that they're the best anti-inflammatory we have on the market, and that's what we're trying to do, is reduce inflammation and pain, as well as address some of the biomechanical issues or maybe some of the support issues. But treatment is multimodal, meaning we're going to use 2 or 3 different things to achieve the results. The foundation in that acute swollen patient is a steroid injection. Although some patients say they're painful, we try to do our very best to reduce the pain associated with the injection in the office using things like cold spray and other modalities to help reduce the pain. Stretching is foundational. Like I said, we have to address the mechanics associated with plantar fasciitis, and stretching allows us to do that. Up to 80% of this is associated with a tight calf, so we need to focus our stretching around the calf as well as around the plantar fasciitis. Physical therapists do a wonderful job of this, and later we'll be shooting another video with a physical therapist to discuss some of those stretches that we do. But this is foundational, both short-term and long-term, for the treatment of plantar fasciitis, and is aimed mostly at the tightness of that calf. And its goal is to restore better motion, better biomechanics to your ankle joint as it goes through what we call dorsiflexion, or the foot moves up towards the shin bone. Adequate stretching, massage, icing are critical to improving the symptoms, both long-term and short-term. Knife splints are another great option. This is a device that you may get from your physician, and its goal is to stretch out both the heel, the plantar fascia, as well as the calf muscle. You wear it at night, typically while you sleep, although sometimes some patients cannot tolerate it all through the night. Even if you can wear it a few hours while you relax and then a few hours during the first part of sleep, it will greatly benefit your improvement. It stretches out that calf as well as that plantar fascia so it doesn't tighten up at night when the fascia is nice and relaxed. The right types of shoes and inserts are critical. We have to have shoes or inserts that control the amount of pronation or flattening of the arch that the foot goes through. So finding the right shoe, or if you want to wear different types of shoes, I would recommend an orthotic that can go in and out of your different types of shoes that will still provide you with the control that you need. The one caveat to that is that trendy shoes generally are not going to work with orthotics. So little flats, flip-flops, high heels are going to be more difficult to find an orthotic that works with those kind of shoes. But most other types of shoes should work just fine. But the question then is, what do we do with these patients that have had plantar heel pain for years and are struggling despite multiple different treatment options? And this is where I think myself and our team at Platte River Foot and Ankle Surgeons really make a difference. There are some great options on the market for these patients. One is what we call extracorporeal shockwave therapy. This uses mechanical stimulation and sound waves, and it's non-invasive. Patients lie comfortably on their back while we mechanically stimulate and try to reduce the amount of scar tissue and promote inflammation, angiogenesis, which is the inflow and growth of new blood vessels around the plantar fascia to promote healing and reduce your pain. It's been shown time and time again. It's been around for 20 years, and the literature is very good on it for chronic conditions. PRP injections. This stands for platelet-rich plasma. And the great thing about this is that instead of injecting a steroid around the fascia, we draw your own blood off, we spin it down, we concentrate the platelets which house the growth factors, and then we re-inject your own platelets back around your plantar fascia with all those growth factors that it stimulates all those growth factors to be brought to the area to promote healing around the plantar fascia. Studies have been shown again, comparing steroid versus PRP injections, showing them to be equivocal in the improvement of the patient's symptoms. Unfortunately, sometimes, despite our best efforts, surgery is necessary. The good news is that the literature has shown that surgery is an effective treatment for plantar fasciitis. The foundation of surgery involves what's called the endoscopic plantar fasciotomy. This is done with very small incisions and a scope where we release a portion of the plantar fascia to reduce the tension and the force across the plantar fascia and improve your symptoms. In combination with this, I do recommend a lengthening of your tight calf muscle if you have that tight calf muscle, and that's done through a procedure called a gastroc recession. And again, this is done through a small incision where the gastroc fascia is lengthened to allow increased amounts of range of motion at the ankle joint. Beyond this, there are some newer procedures like Tenex, and the goal of Tenex is very minimally invasive to decrease amount of scar tissue and create inflammation, whereby we can create healing of the plantar fascia. The bottom line is that if you're in that category where you need surgery, find a qualified surgeon. They'll be able to review these options with you, and they are effective for the right kind of patient. Plantar fasciitis and heel pain can be debilitating, and it can prevent you or your loved ones from doing the things that you want to do and enjoy. The good news is there are solutions out there that we can treat this, whether you're in that very acute stage or that chronic stage, and reduce the pain, get you back to the activities that you enjoy and love, and back to doing the things you enjoy and love without having to deal with the pain. We hope it's been information for you. If you have any questions, please don't hesitate to reach out to us, text, call, email, or come by and see us if you need an appointment.